Good evening, ladies and gentlemen. Welcome to Colgate Oral Health Movement Summit in partnership with News18 Network and Indian Dental Association. Please put your hands together for your host, Kritsween Walia.
A very good evening, ladies and gentlemen, to one and all present here on behalf of Colgate-Palmolive India, Network 18 and the Indian Dental Association. It is my pleasure to welcome you to the Colgate Oral Health Movement Summit, an event dedicated to championing, transforming smiles for a brighter tomorrow. They say smile is the shortest distance between two people. And what could be more powerful than ensuring everyone, everywhere can smile with confidence? Yet, as we all know, in India, awareness and access sound too odd, and we've seen how oral care still faces significant hurdles. Today, we unite the brightest minds from government, policy makers, dentistry, healthcare, media, and corporate sectors to start a dialogue and create meaningful action around the same. Colgate, India's most trusted oral care brand, has been on a mission to drive positive oral health habits. Network 18, one of the nation's leading media networks, amplifies these stories and ensures we shine a spotlight on issues that truly matter. And the Indian Dental Association, our esteemed partner, brings decades of clinical insight, research, and on-ground expertise to strengthen this very movement. Over the course of this summit, we will unveil insights on India's oral health status, showcase innovative solutions that are providing personalized digital dental screening reports, helping millions of Indians actively take charge of their dental health. We will also honor the incredible change makers who make healthy smiles possible. So get ready for an inspiring evening of conversations, collaborations, and commitments. Because when it comes to oral health, every voice, every effort, and every smile indeed does count. Thank you once again for being with us, and let's begin this journey towards a healthier, happier India, one bright smile at a time. To set the stage and give us a quick glimpse into the transformative work that oral health movement has been doing across the country, I'd like to direct your attention to the screen. Let's witness how Colgate is transforming the oral healthcare landscape through technology.
For over 8 decades, Colgate has been India's most trusted oral care brand, championing innovation, education, and access to better oral health. We have grown alongside this vibrant nation, becoming a household name. And today, Colgate is the most penetrative oral care brand in the country, reaching 9 out of 10 households. Our legacy is more than a story of business success. It's built on innovation and science-backed solutions that address India's diverse needs. Globally, with over 900 scientists, more than 10,000 patents, and 7 global technology centers, we continue to set new benchmarks in oral health, ensuring every smile receives the care it deserves. We have always aimed not only to provide the best oral care products, but also to educate and empower our communities. And that commitment comes to life through Colgate Bright Smiles, Bright Futures, which has reached over 185 million children by partnering with schools and governments to instill lifelong oral care habits. Our commitment to sustainability and community development reflects our pledge to be a force for good. Through initiatives that promote environmental sustainability and social responsibility, we aim to secure a better future for generations to come. While we have made great strides in this journey, there is still much to do to ensure that every Indian has access to the knowledge and care needed for a healthier smile. To bridge this gap, Colgate India has partnered with Network 18 and the Indian Dental Association to launch the Oral Health Movement. This movement has empowered millions of Indians to take charge of their oral health. enabling them to assess their dental health on their phones, receive instant reports, and avail a free dental consultation near them. With millions of Colgate bags carrying this message and a robust 360-degree outreach, this initiative is driving one of India's largest on-ground oral health campaigns. With almost 4.5 million screenings already, this transformative movement is bringing oral health awareness and dentist access to Indians like never before. Because every Indian deserves a smile, and a bright smile begins with the foundation of great oral health.
Surely every Indian does deserve a smile. Ladies and gentlemen, it's now my pleasure to introduce a special message from Noel Wallace, Chairman, President and Chief Executive Officer at Colgate-Palmolive. Let's hear directly from the global leader behind Colgate's transformative vision in oral health care.
Hello, everyone. Colgate has been proudly serving the people of India for 87 years. Our journey began with a simple yet profound belief. Everyone deserves a future they can smile about. This belief has driven our unwavering commitment to improving oral health in India and across the globe for more than 200 years. Today, Colgate is not only a household name found in more homes than any other, but also a symbol of enduring commitment to the communities we serve. Globally, we are leaders in oral care, championing initiatives that promote education and preventative care. Our programs have reached nearly 2 billion children and their families about the importance of oral hygiene and equipped them with the tools they need to maintain it. In India, our flagship initiative, Colgate Bright Smiles, Bright Futures, has touched the lives of over 185 million children since the 1990s. This program reaches underserved communities where people are born, live, work, learn, and play, promoting health, equity, and well-being. Now, our team in India is on a mission to bridge the gap in oral health care access and awareness. Traditionally, we have celebrated an annual Oral Health Month, which last year culminated in the launch of the Oral Health Movement. This tech-driven initiative offers personalized AI-based dental screening reports and facilitates free consultations with nearby dentists. This has helped empower individuals to take charge of their dental health. Our commitment relies on collaboration. We firmly believe in the power of partnership and are dedicated to working closely with the governments, dental professionals, and health organizations. By aligning our efforts, we aim to support initiatives that prioritize preventative care and ensure that oral health is an integral part of public health. I look forward to your invaluable support and collaboration. The journey towards a healthier future and brighter smiles continues, and we are honored to travel alongside each and every one of you. Thank you.
And as you've all seen already, amongst us is a very special personality, Union Minister Jagat Prakash Nadda ji. Sir, thank you for joining us this evening. Can we please have a huge round of applause for the Honorable Minister? And thank you, Mr. Noel Wallace, for that inspiring message and for reaffirming Colgate's unwavering commitment to advancing oral health globally. Building on that powerful vision, ladies and gentlemen, it is now my honor to welcome a remarkable leader who is championing this mission here at home. Ms. Prabha Narasimhan, Managing Director and CEO of Colgate-Palmolive India, has been at the forefront of driving meaningful change, strengthening Colgate's legacy, and shaping the future of oral health in our country. Please join me in welcoming Ms. Narasimhan to share her insights on this stellar journey.
Thank you very much, Kritsveen. Good evening, everyone. A special welcome to our honored chief guest, Shri J.P. Nadda ji, the Honorable Union Minister of Health and Family Welfare, Government of India. Sir, your presence here is a powerful testament to the government's commitment to public health, and it inspires us all as we work towards a healthier nation. It's truly also an honor to see such a distinguished gathering of healthcare leaders, policymakers, dental professionals, teachers, students, all united by one single mission, the mission of a healthier India. In this mission of a healthier India, Colgate has been at the forefront as far as oral health is concerned for the 87 years that we've been in this country. A trusted brand with a legacy of innovation every single year. The challenge, however, is that oral health is often an underlooked part of health. As far as consumers are concerned, when you ask them first about their health, they don't really think about their oral health. And the opportunity for us is really to establish and express and convey how much oral health actually has a connection to other systemic diseases like type 2 diabetes and cardiovascular health. It really is an easy way for people to improve their everyday health. Commendable strides, like all of you know, have been made in India in the area of health with the launch of the National Oral Health Program, Ayushman Bharat, of which we have one of the architects in the room, the National Dental Commission, and the draft National Policy of Oral Health. Many, many strides have been taken, and there is still, however, much for us to do. We have an opportunity to strengthen public awareness, build infrastructure, including those of the dental professionals, and of course, drive the continued public and private partnership. We are extremely grateful that we have many states that partner us in this mission as we look to drive our Bright Smiles, Bright Future program. Now in its 5th decade of operation, this program goes at the grassroots level from school to school, teaching children the right way to brush their teeth, the right way of using toothpaste and a toothbrush, how to use it, and making them the ambassadors of change. We have many young minds in this room today, and they truly are the ambassadors of change. Since its inception, BSBF has impacted more than 185 million children across India. And if you count their family members, then we are close to impacting 750 to 800 million people. It truly is a legacy that I'm very, very proud to continue. Last year, we reached 8.2 million people. Building on the wonderful legacy of the Bright Smiles, Bright Future program, last year we started the oral health movement, realizing that oral health is not something that we should discuss for a day or for a month, but something that requires focus entirely through the year, through a lifetime. We're extremely grateful for the partnership of the Indian Dental Association, whose 50,000 dentists have generously given their time to the oral health movement to allow consumers to have free screenings. 4.5 million Indians have registered for the oral health movement. In just the 6 months that it has been underway, and we're extremely grateful to them for the initiative and the enthusiasm that they have shown. 1/6 of these 4.5 million consumers have actually also visited the dentist, and we're absolutely sure that both with the information that they have and the expertise consultancy that they have received from the dentist, that all of their oral health is certainly on the path to getting better and better. Looking forward, I would love to think that we would be able to continue this kind of partnership and envision a future where oral health is prioritized through policy. We are really interested in bringing to life our mission of better oral health for everyone in this country. We thank you all for being here at this event today, and we thank the Minister once again for his time and his affirmation. Thank you very much.
I'd request you to please stay back on stage, ma'am. Thank you. Thank you so much for your kind, generous words, and thank you for your work, incredible work. We're all really looking forward to hearing more such stories. With that, I would also request Mr. Santosh Menon, Chief Content Officer, Network 18, to kindly join Ms. Narasimhan on stage. And ladies and gentlemen, it's now my great honor to invite our esteemed chief guest for the evening, a visionary leader who has been at the forefront of India's healthcare transformation. Ladies and gentlemen, please put your hands together for Shri Jagat Prakash Nadda, Honorable Union Minister for Health and Family Welfare. I would now request Mr. Menon and Ms. Narasimhan to felicitate the Honorable Minister. Thank you, Mr. Menon. Ms. Prabha. And now, with great respect, may I request J.P. Nadda ji to kindly deliver the keynote address.
आज के इस कार्यक्रम में उपस्थित मेरे साथ श्री संतोष मेनन जी, मिस प्रभा नरसिम्हन, the Managing Director and CEO of Colgate-Palmolive India Limited, experts, health professionals, leaders in the health area, and my friends from the print media and electronic media, ladies and gentlemen. It's indeed a matter of great opportunity for me and a very happy occasion when we are discussing a very critical subject, that is the oral health. When I talk about oral health, I also congratulate the Colgate-Palmolive India Limited and the News18 for collaborating and organizing this summit. As we all know that the Colgate India has started a movement which started in 2024, which I am told, and along with News18 Network and the Indian Dental Association, that they have tried to create an awareness about the oral health, which is a subject which needs much attention at this point of time. So I really congratulate and thank them for coming out with this program. It is also very heartening to note, बहुत खुशी होती है कि experts और हमारे policy makers और हमारे public के stakeholders, all three together have gathered here to discuss how to strategize and how to see to it that in future how we can address this issue. That is very heartening to note. If I talk about the program which was started by the Colgate and the News18 Network, it is about the awareness, about making people aware about the good practices and promote oral health, and also it is also related to nutrition and very much related to tobacco cessation. So all this combined together, an effort has been made that in a holistic approach, how do we address the oral health issue that is very important. I am told that that more than 5.5 crore population has been touched, or more than 5.5 crore population have been brought into the ambit of this movement. And also I was told that 40 lakh screenings have been done. That means 4 million screenings have been done. That is very encouraging, and I thank and I congratulate Colgate and News18 for these dedicated presentations. Here I would also like to talk about the importance of the oral health. Although we give very little attention to the dental and the oral health, but that is one of the most important aspects. Our rishis, our sages, our saints used to say that it is the gateway of the body. यहीं से शुरुआत होती है और इसलिए we have to give due priority to oral health, which has been neglected and which as a common man we consider it to be not very important area, but it is one of the most important area which needs to be addressed. It also helps us to address the systemic health, and for that also we know that there are many problems जो हम face करते हैं और उन problems को solve करने में oral health is a very important factor. Nutrition is also, and for the quality of life. Here I would like to say that under the dynamic leadership of Prime Minister Narendra Modi ji, the National Oral Health Program was started in 2014. So we can say that since our government came, top priority was given to National Oral Health Mission and National Oral Health Program. And for that, we decided that oral health should be accessible, affordable, and not only accessible, affordable, but a quality health care should be given. And for that, we had to develop the systems, the structures, and the training part, which was very important to make it, to implement it at the grassroots level. You will be happy to note that as far as the oral health is concerned, in 2014, this program was only in 103 districts. And now, after a decade, I can say that it is now, the program is being run in 773 districts. So a long leap has been taken. And this itself means how the policy makers makes a difference and how the implementation part starts. Because the National Oral Health Program started in 2014. That means before that, the attention towards oral health, as far as the Government of India's policymakers was concerned, was not as it should have been. But now, since 2014, we have been able to go forward. I would like to share with you that in 2014, we had only 398 dental care units. And now we have 9,183 dental care units. So you can understand how many times the structural and the infrastructure for the dental healthcare, because talking about dental healthcare does not mean anything if you do not make it realize. And when you have to realize it in reality, you should have the structure, you should have the manpower, you should have the HR. So all that was taken care, and now approximately 9,183 dental care units are being run. The National Health Mission also gave due priority to this National Oral Health Program. And when I talk about that also, 99.5% of the district hospitals were given the dental care unit by the National Health Mission, that by the National Health Program. And in the sub-district hospitals, 89.2%, the whole infrastructure was developed by NHM. And in community health centers, 72.9% of the funding part was taken care by the National Health Mission, only to make it realize as far as the structure is concerned. We have started a e-Dant Seva also, an interactive website, and also a mobile application which gives us valuable information about the hygiene and the preventive part of the strategy as far as the oral health is concerned. We started a Center for Dental Education and Research in All India Institute of Medical Sciences and the Center of Excellence for the National Oral Health Program. So Now the All India Institute of Medical Sciences is not only Delhi, is not only a department of dental health care. It is a program where we have started the dental education and the research and the Center of Excellence for the National Oral Health Program. We have also developed 3 national resources. One is the oral potentially malignant disorders, which is being run in Lady Hardinge Medical College. The another is the oral health care for children and elderly, that is being run in PGI Chandigarh. And the third is the oral health for tobacco cessation, which is being taken care by the Maulana Azad Medical College and Medical Sciences. As far as the Government of India is concerned, I would like to share with you that the oral cancer, the screening or part of the oral cancer, the program for the prevention of control of NCDs, a total screening has been done for 31.98 crores. That is, the screening part has been done. And the persons diagnosed with the cancer was 1,77,000 who are being diagnosed and who are being treated through this screening. So this is all because of the infrastructure which we created, and because of the infrastructure in the past 10 years, these screenings were done, and because of these screenings, we were able to diagnose the cancer, oral cancer, and the treatment started. The patient being treated is 1,67,000. I'm just giving you the figures just to strengthen my argument that how Government of India is trying to go forward for addressing the issue of oral health. The Ayushman Bharat, we have got Indu Bhushanji here. He was the person who was the first CEO of the Ayushman Bharat and the architect who developed the world's largest health coverage program. And in that also, 22 procedures of advanced oral facial surgical interventions were included in the Ayushman Bharat package, and approximately 15,900 claims were made, and more than 12 crore 34 lakh has been spent on addressing this issue as far as the oral health cancer is concerned. The milestone was in the oral health, that was the National Referral and Research Institute for Higher Dental Studies, that is in All India Institute of Medical Sciences, Delhi. So it's not only that we are trying to see to it. Dr. Kharbanda is there, I can see him. He was there at that point of time when this was being materialized. And it's not only that at this point of time we are doing treatment, but we also need an advanced research system. And for that advanced research, the All India Institute of Medical Sciences, a pioneer institution of Government of India, has taken the lead that I would like to share. Which was inaugurated in October 2024 by Honorable Prime Minister. I would also like to share with you that how policymakers make a change. You see, we had a policy of health policy was initiated and developed in 1997. That policy was a policy which took care of the curative part. It was only the cure part which was taking care. And cure part also, the tertiary healthcare was given the utmost priority. But in 2017, we came out after due consultation with all the stakeholders, having conferences, regional conferences, talking to the stakeholders, talking to experts, and then we came out with a National Health Policy of 2017, which was holistic in nature. When I talk about holistic, it was inclusive also. And when I talk about inclusive, it means it was not only the curative part, it was the preventive part, it was the rehabilitative part, it was the curative part, it was the geriatric part. All together in a holistic manner we have tried, and that health policy in 2017 was initiated, which has brought a change. And when I talk about holistic and inclusive, we gave priority to tertiary, but at the same time we gave priority to the secondary health care, and we gave the utmost priority to the primary health care. And when I talk about primary health care, it means that now we have got 1,77,000 Ayushman Arogya Mandir, which was previously called as sub-centers. Now this Ayushman Arogya Mandir, we have a healthcare package of 12 packages of 12 areas which is being addressed at these. We have a community health officer there, and with community health we concentrate on the reproductive and the child health. We take care of the ENT part, the eyes, nose and throat. We take care of the dental part, the mental part, and the early palliative part. And mass screening is being done for hypertension, for diabetes, for cancers, and in cancer for oral cancer, cervix cancer and breast cancer. The screenings are done at the Ayushman Arogya Mandir. Now again, I will again emphasize that what is the importance of the structural change which has been brought. When I talk about 1,77,000 Ayushman Arogya Mandir, this is the first point of contact. And this is where the care starts. And we have decided that at the age of 30, we will have a screening of all citizens for dental health, for mental health, for hypertension, for diabetes, so that we are able to early detect who is going to become a patient of heart patient, or who is going to become a diabetic in coming times, and what precaution he has to take. When I say so, you will be saying कि ये तो अच्छा लगता है, शब्दों में तो बहुत अच्छा लगता है, शब्दों में नहीं, यथार्थ में भी अच्छा लगेगा आपको. When I will share with you that hypertension, 18 crore people have been screened. The same way for diabetes, 17 crore people have been screened. And more than 30 crores have been screened for oral cancer. Breast cancer is 7.5 crores, and cervix cancer 4.5 crores. So this, you imagine the number itself speaks how the urban life, who are not aware about the oral health, they are being brought into the fold through these आयुष्मान आरोग्य मंदिर. इन लोगों के माध्यम से हम प्रयास कर रहे हैं कि उनको वहाँ पर इसको किया जाए. और सबसे अच्छी बात यह है कि we have started teleconsultation in these आयुष्मान आरोग्य मंदिर. So when I talk about teleconsultation, you don't need a specialist. You need a community health officer who is only going to take care and who is going to screen and show the x-rays to the dental health care doctor, the specialist, and he is going to suggest that he is to be brought to the community health center, or he is to be brought to this district hospital, or he is to be brought to the state hospital, and that is how the care is being taken, and this I would like to share with you. A very important role this Ayushman Arogya Mandir has played in the elimination of the tuberculosis, for immunization. That is also a very important part, because mother and child health is a very important part, and that is also being taken care. When I talk about the reproductive and mental the maternal health, I would like to share with you that the decline of the maternal mortality ratio, MMR, in India which was 130 per lakh lives, has now reduced to 93 per lakh lives, and this data I am giving of 2020-21, when Corona was at its peak. When we will get the data of 2025, it will be much more lower. The decline must be much more faster. The decline of the infant mortality rate in 2014 was 39 per 1,000 birth lives, and now it has been reduced to 27 per 1,000 live births. So, and this is data is also of 2020-21, when the corona was at its peak. 25 will speak another story altogether. The under 5 mortality, if I'm talking about, the India's decline is 42%, the under 5 mortality, and the global decline is 14%. So you can understand what is the level at which India is working. The neonatal mortality of India has declined by 39%, and the global decline is only 11%. So we are much more ahead as far as the decline is concerned, and we are trying to see to it. And you see, it's a 1.4 billion country of 1.4 billion. And when we talk about, see this huge size of the people whom we are catering. I would also like to share that we have eliminated the trachoma as the public health problem in 2024, and WHO has recognized that. And we are on the verge of eliminating Kala Azar. So that is also a very important aspect. As far as tuberculosis is concerned, recently in the month of March and April, a World Health Organization report was there, and it said that India's decline of tuberculosis is 17.7%, and the global decline is 8.3%. So we are more than the double as far as the decline is concerned. And the increase in treatment is 53% in 2015, and now it is 85% in 2023. So this is how, with these figures, I only want to share that how India has taken a long leap as far as addressing the health issues are concerned, and how the data is showing that India has really addressed these issues in a big way, and we are going forward with the full momentum under the leadership of Prime Minister Modi. Medical education is also a very important area where we are going ahead. हम लोग सुनते थे when in my 70s and 80s, 1970s and 80s, when we were school and college going students, so then we used to hear ये brain drain हो रहा है, और हमारे doctors बाहर जा रहे हैं. मैं भी पूछ बैठता था कि आप बाहर क्यों जा रहे हो? So at that point of time they used to say that we do not have the necessary infrastructure where we can work. But now you will understand that in medical colleges we have gone in a big way. We had only 387 medical colleges in 2014. Now we have got 780 medical colleges in just a span of 10 years. The seats of undergraduates has increased from 51,000 to 1,18,000. And in next 5 years, we are going to have, including UG and PG, 75,000 seats. We are going to increase in next 5 years. That is how we are working. The PG seats increased from 31,000 to 74,000. So we are trying to see to it that how the PG seats, and all this I am talking because so long as you do not have the sufficient manpower, so long as you do not have the sufficient HR, human resource, so long as you do not have the technicians, we cannot really cater, it may be dental health, mental health or any other health. So that is why the increase is so immense that on which we are working. Since 1960s till the end of this century, we had only one All India Institute of Medical Sciences, New Delhi. Only one. It was in Atal Bihari Vajpayee's time that we had 6 more All India Institute of Medical Sciences. And during Prime Minister Modi's regime, now we have got 22 All India Institute of Medical Sciences. A state of the art. So now our doctors, our medical students need not to go outside. We have got the best facilities here for research, for development, for addressing the health issues. And that is how we are working. One more thing I would like to share with you is about the Ayushman Bharat. Indu Bhuchan ji is there. When I say it is the world's largest health coverage program. In 2015, I got the opportunity to, as a health minister, to chair the World Health Assembly, because at that time the chair was with India, and I, being the health minister, had been to Geneva to chair the World Health Assembly. At that point of time, the catchword or the slogan of that time was UHC, Universal Health Coverage, Universal Health Coverage. And I used to think whether India will be able to do that. Universal health coverage hum de payenge, ho paega. When I came back, I started doing some program, and then I discussed this with Honorable Prime Minister. I said कि हम चाहते हैं कि insurance नहीं हो, assurance हो. Insurance does not work. We have to give the assurance, and assurance should be from the state part. And so we should give an assurance of 1 lakh rupees at that point of time. And Prime Minister Modi said to me, think big, bada socho. I went back, and then he announced the world's largest health coverage program, 40% of the Indian population. At that point of time, 12 crore 18,000 families, which came to 55 crore people, which was the 40% of the Indian population. And now the ASHA workers, the Anganwadi workers, they have been included, and every citizen above the age of 70, of any sex and of any economic background, all are covered, and now 62 crore people are covered under Ayushman Bharat, the world's largest health coverage program, which includes 22 types of packages for dental health care also. And you will be also happy to note that the out-of-pocket expenditure, and this is not my data, this is the data which has been given by international agencies. And now the health out-of-pocket expenditure, which was 62.6% in 2014, has now reduced to 39.4%. So out-of-pocket expenditure is reduced, and the Government of India has taken care about this also. This we have to understand. In Ayushman Bharat, the cancer patient, and this is not my report, this is the report of the Lancet, which says that the 90% of the people who face cancer, the treatment starts within 30 days from the day of diagnosis. Within 30 days. And these are all common people. They are all below poverty line, about whom we are talking. And this is how we are working and going forward. So I have tried to share with you about the aspects. I would like to give the commitment from the Government of India that we are very positive about the oral health care. And I commend the News18 and Colgate India for coming out with the program, and I assure that we will go forward in this direction. एक बात जरूर है कि मैं इतना कुछ बोलता हूं, आप सब लोगों ने तालियां भी बजाई, आप लोगों को अच्छा भी लगा होगा, लेकिन कुछ लोगों को ये रास नहीं आता है. कुछ लोग हमेशा विपक्ष की भूमिका ही अदा करते रहते हैं. मैंने सारे आंकड़े आपके सामने, I put all the data. I started from 2014. I never talked before that. I only talked कि 2014 में क्या था और 2025 में क्या है. अब हम किसी की नजरें तो ठीक कर सकते हैं. एज हेल्थ मिनिस्टर भी मैं ठीक करवा सकता हूं. But I can't give them the eyesight. I can't give them the vision. मैं दृष्टि नहीं दे सकता. और मैं इतना ही जरूर कहना चाहूंगा, और क्योंकि मैं न्यूज़ 18 के कार्यक्रम में आया हूं, तो इसको राजनीतिक रंग तो नहीं देना चाहता, लेकिन गैर जिम्मेदाराना विपक्ष प्रजातंत्र के लिए घातक होता है. ये हमको समझना चाहिए. Irresponsible opposition is very dangerous for democracies. And so we should realize and we should understand what the difference brings, what the difference comes with the change of the policy makers, what difference it makes as far as the implementation part is concerned, and how India becomes healthier and healthier under the dynamic leadership of Prime Minister Modi. Thank you very much for giving me the time.
Thank you so much, Honourable Minister, for your inspiring words. Sir, I would request you to please stay back on the stage for a very special announcement. Also requesting Mr. Menon, Ms. Narasimhan and Mr. Amish Devgan from Network 18 to be on the stage for unveiling of a special book titled India's Oral Health Report, Transforming Smiles for a Better Tomorrow, a tribute to the milestones, insightful data, uncovered and collective impact of the oral health movement. Ladies and gentlemen, this book showcases how together we're reshaping the future of oral health in India, one smile at a time. So please join me in applauding this collective journey as we unveil this special publication. Thank you so much, Honorable Minister. Thank you, Mr. Menon, Ms. Narasimhan and Mr. Devgan. Thank you. And now, ladies and gentlemen, it's time to take a deeper look at the journey so far to understand the insights we've gathered through the Colgate oral health movement, the progress we've made and the path ahead. To walk us through an in-depth presentation on India's oral health score and the impact of this transformative movement, please join me in welcoming Mr. Gunjit Jain, Executive Vice President, Marketing Colgate-Palmolive India Limited. Over to you, Gunjit.
Good evening, ladies and gentlemen. Thank you so much for giving me the opportunity to be here with you. And thank you so much for taking the time out to be here with us. As Executive Vice President for Marketing for Colgate-Palmolive India Limited, it fills my heart with pride that we were instrumental in getting 4.5 million Indians to screen their dental health over a period of 6 months. It's been an amazing journey. We are super proud of it. Not only did millions of Indians get to know more about their oral health, we got to know more about India's oral health. And if there is one rallying cry in this entire treasure trove of data that's rising up from beneath to the top, screaming for all of us to take notice, then that particular rallying cry is that India's oral health needs help. India's oral health needs help because India's average oral health score is 2.6 out of 5. If we take all the 4.5 million dental screening reports and spread them across different scores that we've got, on the right-hand side of this slide, you will see that it's heartening to see that about 19% of Indians have a score, a healthy score, of 4 or 5 out of 5. It is also disheartening to see on the left-hand side of the screen that about 50% of Indians have a score of just 2 or 1 out of 5. This is the case because 72% of Indians are at high risk of at least one dental problem. 14% at high risk of stains, 41% cavities, 44% gum issues. If we again take all the scores and spread them across different age cohorts, right from children to seniors on the other hand, you see that the overall oral health scores are pretty much even-steven around 2.5, just with the seniors being slightly lower. So it feels like a spread which is quite bland. But colors start emerging when you start layering it with different indications. Stains, for example, the risk goes up with age. Cavities, it peaks with children. It comes down slightly and then goes up again as you age. And the risk of gum issues keeps going up as we age. And now when you look at all of these different layers, you realize that since the load of dental issues is the highest on the shoulders of the seniors, that is why their scores are the most depressed. What we also see, and now we have all of this data, is that these different dental risks are different in different parts of the country. For example, from left to right, you see that stains risk is pretty high in Uttar Pradesh. Right in the center, cavities risk is high in Kerala. Whereas on the right-hand side, you see that gums risk is pretty high in Gujarat. And we have all of this data. And we can slice and dice this data in multiple ways. But what all of this data is telling us in one unison voice is that the dental load of problems on this country is pretty high. So a fundamental question emerges. Why is that the case? Why is it that the dental load on this country is pretty high? And especially, why is it so high despite the fact that every household in this country has a toothpaste at home? We have 100% penetration of toothpaste. Then why is the dental load so high? Is having a toothpaste at home not good enough? And the answer to that is, yes, it's not good enough. It's not good enough because there are other factors that impact oral health. In fact, all the data that we've collected and all the knowledge that we have, we can very easily summarize your dental health outcomes in a very simple linear equation. A plus B plus C. India's oral health outcomes, or your oral health outcomes, are a function of three different variables. A, the oral care habits. B, your systemic health. And C, food consumption habits. And I'll talk very briefly about them. Let's look at oral care habits. Despite the fact that, everybody's got a toothpaste at home, there are gaps with respect to oral care habits. Dentists recommend that everyone should brush twice daily. But 80% of urban Indians brush only once and not twice a day. 55% of rural Indians do not even brush daily. The average replenishment frequency of a toothbrush, again, according to dentists, should be once in 3 months. In India, the average is once in 9 months. And that is why even at this point in time, 53% of Indians have a flowered toothbrush, or what we call a frayed toothbrush, which is harmful for teeth and gums. And again, it is recommended that one should visit dentists once every 6 months, but 91% of Indians did not visit a dentist even once in the last 1 year. So with respect to oral care habits, clearly there is a gap. And while there is a gap on oral care habits, there is also extra pressure that comes in the form of the rising systemic health problems and the rising consumption of foods and drinks that negatively affect oral care. We know that diabetes is on the rise, and our data tells us that diabetes has a very, very, very high correlation with gum problems. We know that tobacco is consumed by a large chunk of India's population, and that has a very negative correlation with stains. Similarly, if we snack very frequently during the day, many of us do, we call it anap shanap khana, there is a higher risk of gum issues. And if we all love sweets, and many of us again do, then there is a high risk of cavities, so on and so forth. So coming back to this fundamental equation, I like to see this as a weighing scale. If on the right-hand side, systemic health issues and food consumption habits are putting pressure on oral health on one side, it is imperative that oral care habits rise above the tide to balance the scale back. And therefore, it is absolutely imperative for all of us to come together. So again, as a representative of Colgate-Palmolive, I want to extend my hand and ask all of you to become part of the oral health movement. We need Indians to start brushing twice a day. We need Indians to replace their toothbrushes on time. We need Indians to go to dentists once every 6 months. We need Indians to get access to dental insurance. There is this need. We must join hands. The time is now. The time is right. India needs a movement. India needs the oral health movement. Thank you, ladies and gentlemen.
Thank you, Gunjit, for that insightful presentation. You've highlighted not just where we stand today, but the incredible potential we have to create a healthier, brighter future for all of India's smiles. And now, ladies and gentlemen, we move into a vital conversation that will explore how policies and governance can drive this mission forward. So it's my pleasure to invite Mr. Prabha Narasimhan, Managing Editor at CNN News 18, to moderate our first panel discussion of the evening. May I also invite our esteemed panelists to the stage. Ms. Prabha Narasimhan, Managing Director and CEO, Colgate-Palmolive India Limited. Dr. Indu Bhushan, Independent Director and former CEO of Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana. And last but not the least, Padma Shri Dr. Mahesh Verma, Vice Chancellor, Guru Gobind Singh Indraprasth University. Ladies and gentlemen, please join me in welcoming them for what promises to be a truly insightful discussion on advancing oral health for a Viksit Bharat, the role of government policies. Anand, the stage is yours.
Thank you, Prithveen. Thank you. Namaste to everybody. There is the Narasimhan connection. Other than that, we don't know each other. I'm meeting her for the first time. Well, thank you so much. Now, it's truly a privilege to be a part of this important dialogue this evening. Oral health is often called the mirror to overall health, and yet it remains one of the most overlooked areas in public health policy. Everybody says smile, but they don't realize how important oral health is. It all starts with that, doesn't it? But as we look towards a Viksit Bharat, the time is now to change that. Today's conversation will explore how policies, partnerships, and innovation can drive meaningful, lasting change in the oral health across the nation. And together with our esteemed panelists, we'll try and reflect on what's working, what more needs to be done, and how can we set global benchmarks in this very critical area. So let's begin. And my first question is to Prabha Narasimhan, MD and CEO, Colgate-Palmolive India Limited. Good to see you and chat with you. Now, there's been a long story, many decades, isn't it? Colgate's foray into dental health and oral care. Now, let me first ask you, how can technology be a game changer in this field?
So I think firstly, it's absolutely a pleasure to be here. I didn't get a chance to say that in my previous speech, and thank you all once again for coming. I think if I can use maybe our most recent oral health movement as an understanding of how technology can be a game changer, what we had as part of that movement was an AI-powered app that basically allowed you to take a few pictures of your mouth and then get an assessment of your oral health. And this is an initial stages. We are in fact the first Colgate country in the world to use this kind of technology, and this itself blew us away in terms of what it could do and how much it could assess without the need for a professional. So the professional's time can then be stage 2 rather than stage 1, and we found it to be exceptionally useful. And I imagine that this technology is only going to grow leaps and bounds very, very quickly, and by the time we do OHM Part 2, Gunjit and my team have already committed that we will be significantly better than where we are today. So it's been a revelation, and we expect more.
It starts from being part of the consideration set. So let's ask the former CEO of Ayushman Bharat, Dr. Indu Bhushan, this case, कि usually health insurance में सबसे पहले क्या कहते हैं? To the teeth, दांत is not involved. You know, oral care, oral hygiene, all of that is not involved. Now, from when Ayushman Bharat promised healthcare, was there ever this thought that oral health also needs to be looked at, that needs to be part of it?
You know, when we started Ayushman Bharat in 2018, at that time we included 1,236 different health conditions, and dental health or oral health was not one of them. But slowly, as the feedback came, including from IDA, that there are some health conditions related to dental health or oral health which also put poor people below the poverty line or deeper into poverty. So as the Honorable Minister was saying, we included 22 packages. But again, you know, those 22 packages which are there in Ayushman Bharat are not enough. And especially since now we have included 70 plus people, all 70 plus people, including those who are rich or poor, in the purview of Ayushman Bharat, obviously one of the things they struggle with is dental health. So we'll have to increase the coverage in terms of benefit packages in Ayushman Bharat for sure. And I'm sure the government is doing this.
I have to share an interesting anecdote. Many years ago, I started working for a company, not my current employees, many years ago. And they said, insurance hai, aapka company will pay insurance. So, but dental health, oral health is not there. So I asked them a question, why? I said, no, it's all cosmetic. So I said, what if I have cancer because of, not taking care of my dental health? हाँ, वो हम cover करेंगे. So I said, what's the logic? He said, no, sir, that's how the insurance policies are and that's how things are.
So that's why I liked the way Honorable Minister mentioned that Ayushman Bharat is not insurance, it's assurance. And we are not into it for making profit or ensuring that there is claim ratio is less than 85% or whatever. So here, I think we are looking at, or Ayushman Bharat is looking at improving the healthcare of people, improving the access to healthcare, and reducing their out-of-pocket expenditure. So I think your experience, I'm sure it's because you're dealing with commercial insurance, may be correct, but Ayushman Bharat is different.
No, I know that. That's why I wanted you to say it out loud, that Ayushman Bharat is different. Commercial insurance still is a little reluctant. So that's, again, perhaps something to consider in terms of policy intervention again. But Dr. Mahesh Verma ji, let me ask you. What is the big picture policy in terms of policy, research, innovation? What is it that we can do to start setting some benchmarks as a country?
See, the policy, of course, we have a national oral health program, and a lot has been done under that, as Honorable Minister enumerated. But I still feel that we need a standalone national oral health mission, because the problem is so humongous. Every second person is suffering from dental ailments. So you see, NOHP, which is National Oral Health Program, is like any of the national programs. We have, we have many national programs. So it's just one of the programs. See, the entire issue is so big that, as you said, the big picture. So the policy, of course, it's the policy, it's the reforms in our structure, curriculum, and then also public engagement. You see, today the biggest barrier is that our attitude to the oral health is it's not very positive. Positive in the sense that we just overlook it. And it's so crucial. As the Honorable Minister already said, that there is so much of a systemic linkage with the oral health. So if we are taking care of oral health, it's also going to integrate oral health into general health. It's also going to reduce the burden of the disease, the burden of the cost of the disease. So actually, I feel the biggest policy change required is that we still haven't figured out that how big is the issue. And of course, nothing can be done overnight, but of course, NOHP has done a great amount of work. You see, today they have more than 9,000 dental units, all funded by central government. And this is in addition to the efforts by the state government, because health is a state and a center subject. So I feel that much more need to be done. I have a question that we have in a hospital. You go to a typical hospital, whether sub-center, or you go to a primary health center, or you go to a CHC, community health center, or a district state. This is how the hierarchy is. You go and you find there are 50 medical doctors, and you find just one dental doctors. Don't you think that we need an equal amount of dental professionals, the access not only to the primary care, but also the tertiary, secondary and tertiary and rehabilitative, as we said. So we need a referral system.
This is a very different perspective than what somebody told me, saying dil ka doctor or daant ka doctor, they'll never be out of business, because it's always there. It's always, and those who are in the oral health business, 87 years and counting for Colgate-Palmolive itself. And it's always going to be there as long as there are human beings, as long as we got a face and we got teeth and we got a mouth. This is going to be there.
I think his point is very correct, that we need a mission or policy. And before coming here, I just went through National Health Policy of 2017 word by word. It doesn't mention oral health even once.
It is just a very one or two small sentences.
No, there is not even one sentence. Unless I missed it. So there's nothing there. But if you look at the problem, it's huge. It's a huge problem because.
This was the first time ever they mentioned oral health in the NHP, National Health Policy. Before that, there was no mention at all.
So first time in 70 odd years that oral health has been mentioned. Now, how many of us have taken oral health, our dental hygiene or oral hygiene very seriously? How many of us are conscious about it?
I hope in this room a lot.
See, no, it's still not 100%. It's not even 50%. So if we ourselves are not conscious about it, how are we going to teach our next generation? How are we going to teach the children? And if they are not conscious about it, it's going to become an endemic thing that there will not be this consciousness. There's something called halitosis. And perhaps that's the most brutal form of torture that you can put somebody to. Correct? But that again stems from oral hygiene. Now, if that is not elevated to a policy level, a consciousness level, a movement level, how are we going to attack this? How are we going to do this, Prabha?
I think that's exactly why the word movement features in this, and that's exactly why we have events like this, and that's exactly why we have Dr. Indu Bhushan on our board, and that's exactly why we had the Honorable Minister here, which is to give the platform for something that is so utterly critical and actually much simpler than many of the things that one would potentially have to do, God forbid, if you do get diabetes or you have cardiovascular disease. The actions that you have to take, the money that you have to spend, the burden of the disease is so much higher. And if oral care can even go a part of the way to preventing that, it seems like so much better solution. And all we're really asking for, because this has been my kind of platform for the day, is the 2-2-2 model, which is 2 minutes twice a day for an expenditure of 2 rupees a day can actually get you good oral health.
Fantastic. 2-2-2 model. So now how are we going to make this 2-2-2 model a habit? How are we going to change that? You worked with Bright Smiles, Bright Futures, 185 million children you influenced. But what are we going to do with the 140 crore people? How are we going to change this here?
So I think what we are doing here is actually a plea, firstly, for more partnership, because one organization or one individual or one team or, even a handful of us cannot move this 1.5 billion people. We really are here asking for partnership of all like-minded people to help us to do it. Along with that, we are doubling down on our commitment, saying that this is obviously important to us. It's the cornerstone of our mission, and it's something that we will keep at, and this oral health movement is step one in what we hope will be a long and very successful journey.
But can we take it to the level of a Swachh Bharat? Can we do it? Is it possible? How do we do that? What kind of public, private, government, partnerships, interventions are required?
Anand, of course, see, there's a lot of similarities between oral health and sanitation. One that, all of us need it. All of us need it daily. And both of these require multi-sectoral approach. It's not health, it's also food, it's also education, it's also tribal welfare. All of them have to work together. Also, it has to be data-driven, because we need information about what kind of problems are there, because, it can't be just one approach for all districts. In some districts, maybe problem is because the kind of things they're eating. Probably their use of betel nut or tobacco, or the water is a problem. So we have to be data-based. Third is that there has to be collaboration between public, private and civil society, which was there in Swachh Bharat as well. So I think there is a lot of similarity between oral health and sanitation, and we have to start with a strong political commitment, like Prime Minister Modi was behind Swachh Bharat, and if he has a clarion call that we have to have a similar mission for oral health, like Honorable Minister also mentioned today, I don't see any reason we can't achieve that. There is a problem, I earlier told you. If we compare ourselves with all our G20 countries, I think we have the worst oral health issue because there is a metric called DMFT. All the doctors would know this is decayed, missing, and filled teeth. So that metric, by the time we are 12 years old, this is about median is 2. So we have 2 teeth out of 32 which have a problem, and the same figure is about less than 0.5 for other countries. So if we want to be Viksit Bharat by 47, I think we need to focus on this issue, and I think it can be done.
Do you know our jaw lines have become smaller? The current generation has only 26 teeth and not 32. Yeah, because
they still have, but
28 and not 32. 2 दांत extra, चलिए. पर 4 कम है. 4 कम हो गए. उसमें भी 2 कम हो जाते हैं. Something wrong. So are there not enough dentists?
There are plenty. There are plenty. In fact, we could utilize all this manpower for the national development, because there are so many dental professionals looking for jobs. So we have dentists and we have a need. We got to do something so that, we can fill this gap. See, we have the distinction of one of the countries having largest number of dental schools. There are 320 dental schools. If there are 700 medical colleges, and we have almost half the numbers dental colleges, almost 25,000 dentists are passing out from these colleges every year. So they are looking for jobs. And so we have to come up with a policy where, they can be employed. They would be contributing to the economic development of the country also. Isn't it? So there are many ways that when we say Viksit Bharat will not happen if you don't include education, health, infrastructure, innovation, and a dignity to life. All these are the 5 components for a Viksit Bharat. So they have to be involved.
But this is also a sociological thing, Dr. Indubhushan. So I'm just going to, in terms of habit formation, it's a challenge. Now, if you're going to be an evolved nation, a Viksit nation, a developed nation, there is also got to be a certain level of sociological evolution. So from the grassroots up, how do we start this? Habit formation or behavioral change is very difficult to influence or to do. How do we do that?
So
see, assurance, dentist, sorry, beg your pardon. I'm just saying that is all when you're treating the effect, right? How do I stop at the cause level itself?
Well, you are absolutely right. There's a saying that prevention is better than cure, and it's even more true for oral health. Here, we should not even going to a dentist for treatment. We should be going there for other things because we can do that. We can prevent it in most cases. And this movement actually has to start with children. We have to catch the children young, and they have to make the habit, and through children we can reach the parents as well. So we have done that for other things like you mentioned sanitation. So we can also do it for this because this is actually much easier to break where habits can be improved and they can see the impact right away in terms of their improvement in their oral health, and not only oral health, through oral health, overall health.
But there is also, please.
Sorry, if I just wanted to add to, we must also remember the fact that till about 7-8 years ago, actually the penetration of oral care in the country was not 100%. In fact, it used to hover in the late 80s, and some states were lower, some states were higher. But it's only over the last 5-6 years that every single household in the country has got a toothpaste and a toothbrush, which I think itself is a progression. And now from that progression, we need to move them to rural India brushing every day and urban India brushing twice a day. So it is a journey, but since we're talking about it, certainly there's progress being made.
No, what triggers this change? What have you been able to get down? Let me ask you this. You said it was hovering around 70-80%. How did that 20% jump happen? It's because, not that you did not have your distribution in place, something made the people to go and buy it, right? And say that I need to keep it in my house. What triggered that?
So I think from our understanding of the data that we see, there are three things that work. One, as affluence rises, your exposure rises and you start looking around to see what affluent people are doing and you mirror those habits. Second, like Dr. Bhushan rightly said, your children bring home new habits. They get taught habits in school, they bring those habits home. Then you have the ability to indulge, quote unquote, that habit, then you're able to do that as well. And then the third thing, of course, is once you've started taking on these habits which portray you as being advanced, you continue to stay there. And what really makes a difference is the emancipation of women. As women get stronger and get a greater voice in the household, we find that all of these good habits actually tend to move, and they move quite rapidly. So you can see a direct correlation between the emancipation of women and the growth of these habits. So these three things together is actually the perfect secret sauce for us to move some of this stuff, but nothing
So somewhere
moves
aspiration,
quickly.
nothing moves quickly. Tap on that aspiration, tap on the saying that, no, this will take you one level up, with this will take you perhaps a far more, perhaps a little more evolved, state of being in society. But, with that toothpaste and with that toothbrush comes 2 bars of chocolate, there'll be a packet of chips, and there'll be something else which is a cookie or which is sweet. This sugar intake which is happening, how much of that is a problem? No. Let me ask you first, and then आपके टूथपेस्ट में शुगर है? That it starts from there.
Toothpaste mein sugar nahi hai, thank God. Actually, I think, this is one of the things that when we go to rural India and we talk to people and they go, but my previous generation, they didn't use toothpaste, their teeth are fine, they all look okay. Actually, what has changed is our lifestyle has changed. The amount of, let's call it processed food for now, that we have started eating, and the extent to which we eat. We did a snacking survey and we found that an average Indian is eating 4.5 times a day. So at 4.5 times in the day, they are eating something. And that is really quite an assault on your teeth that you absolutely need to take care of. But I'm going to defer to the dentist and doctor to
And
add
we're
to
also
it.
eating that which sticks to your teeth, not that which your teeth are going to crush and then swallow. So we're not eating apples or sugarcane or, fruit. We're not eating that. We're eating chocolates, chips, etc. And this which stick to your gums and stick to your teeth, right? The sugar thing is a huge problem, sir.
Yeah, it's a big problem, and in fact, most of the, all these snacks, they have a hidden sugar, and I think we got to do something, for their labeling, for their advertising. Maybe we could, even some of the countries have sugar tax or sin tax, for sin which you are doing, and the profit from that comes back to take care of these schemes, oral health schemes. So all these, and then, how can we subsidize healthy snacking or healthy snacks? And how do we promote? All this is to be done from the school health program. Their diet, their nutrition, what is good for their teeth, how some of these fruits, vegetables can have a cleansing effect on the teeth, so how that should be promoted, right nutrition, all that has to be inculcated at a very young age, right when they are in the school, their diet counseling, their awareness, all that has to happen. And then, of course, this process, all these school health programs, many a times not directly covered by the dental profession, but there are Anganwadi workers, there are other, Ayushman doctor, there is other multi-purpose workers. I mean, they also have to constantly throw the messages, because this sugar is not good for your teeth, or, because we know that it has a direct linkage to cavities and other oral conditions. So this has to be a consistent effort. And we have to inculcate all these things at an early age so that they grow as a very responsible adult, understanding all this.
So if we say don't eat candies, then somebody will say, "Bhai, hamare pet pe kyun laat mar rahe ho? Hamara bhi to confectionery." The other thing is, every time I eat something that sticks to my mouth, I'll brush. I'll go back and brush.
They can do it.
Unka bhi dhanda chalega, inka bhi dhanda badega.
No, they can do it, but they need to rinse after that. They have to be told, if at all. You can't abstain them from, consuming some of these snacks, but, in between snacks and too much assault is not only oral health, on your general health. all these NCDs, obesities, diabetes, all this is because we are snacking very frequently.
So it's all triggered from what's going in. And this is what is processing and pushing that down your food pipe.
You know, my dentist told me that not only after candy, but also after tea or coffee or alcohol, I should wash my...
Because of the stains.
Because of acid.
Acid and the stains, yeah. Acid and the stains.
Yeah.
But this is all very behavioral, isn't it? To try and tell, हमको सब पता है पर हम करते नहीं हैं सर. छोड़ यार आज एक दिन छोड़ दो. वो एक दिन का 2 दिन हो जाएगा. आज सुबह नहीं किया, रात को ब्रश कर लूंगा, रात को नींद आ गई सो गया, कल सुबह कर लूंगा. This is habit, and then we do it, and then children see it. आप तो नहीं करते 2 बार ब्रश, so why are you asking me to brush twice? Right?
It might happen other way around. Your children will tell you that we are doing it, you should also do it. And I've seen it, you know, I am ashamed to admit that my wife does it twice a day, very religiously, and I sometimes forget. And I have gone back and seen that maybe it was because when she was studying, they were given very strong this oral health education because she was actually studying in the US, and where they provide this information almost in the primary education every day that, you know, this has to be done. And that has stayed with her. But
so that's habit formation that's
yeah,
happened. No, it's
for
conditioned in your brain to say that you don't do it, you're going to have, there's going to be something
and when she doesn't do it, she doesn't feel good about it. So I think once you are, you have that habit, it's difficult to kick.
Okay, so how do we get to doing that in our country? How do we do that? So let's get to that part. If I were to ask you one big policy intervention that needs to be made so that we start thinking like this, all of us.
Okay, if one major policy intervention, I will give you actually buy one, get one, two policy intervention.
Done.
One is, which has been seen all over the world, is fluoride varnishing. And if children are given that fluoride varnishing twice a year, and the research has shown that the caries will go down by 40%, and it's cheap, and it's very easy to implement because it doesn't require big system or doctors to do it. It can be done by field level workers, and it's been done in low income settings like Philippines. They do that. And so that's one small intervention that we can do, which will reduce the burden of disease from oral health by 40%. And without, so it's a very low hanging fruit. So that's number one. Number two is what Colgate has done, provided this AI-based instrument which can very easily scan your mouth and tell you what problem you have. And that can be adopted by Ayushman Bharat Arogya Mandirs, 177,000 of them. And it's cheap, it's easy, and can be done by ASHA workers and field level workers. And if that can be integrated with, say, Ayushman Bharat Digital Mission, we'll have a whole database for 1.4 billion people in terms of their state of their oral health. And that is good for taking follow-up actions wherever we find that there's a problem, but also planning, because we would know the whole oral health map of the country.
So are you relaying a message to the current CEO that this should be done?
I've been in constant dialogue on that, so yes.
Yeah, because you've identified, then it has also to be covered under the Ayushman Bharat scheme to be assured that this can be done. That's where it's going to be. जी, sir.
Yeah, Anand, I think one
तो आपका
very
1+1
easy
हम
step.
record करके भेजेंगे वहाँ. अभी जो आपने बोला है.
Yeah, two things I would like to add. One, I think the easy step would be a massive mass media campaign on TVs, radios, print media, social media. You know, I think it's all about attitude, all about awareness. That's one. And I think we need to expand PMJ, you know, because it has, at the moment, now it is only covering the inpatient dental disorders. 22, which is inpatient. That means you have to be hospitalized to get benefit of those packages. I think, you know, there are whole lots of dental procedure which are secondary and tertiary, which can also be covered under PMJ. So I feel these two to these to initiatives and to interventions can really benefit huge number of our citizens.
What about in our curriculum? What about in the academic?
That was
Yes.
my wish list, actually. You didn't get me a chance to do the genie thing. So if I had one wish, I think that would be it, which is, I think both of you mentioned it, that you learn these habits at a formative age. They stay with you forever. The idea, we are able to intervene as Colgate with the Bright Smiles, Bright Futures at max twice a year in a school. But this actually needs a regular, consistent, daily intervention. So if we can learn from what some of the other countries have done in terms of introducing it in the curriculum and making sure it gets taught, I think that would go a long way for the medium term, for sure.
How about we do something like going to the schools and identifying a 2+2+2 champion? So children start recording every day they're brushing, and for one whole month, 30 days, they upload pictures on a platform or somewhere where they say, listen, I'm conscious of my oral health. It's a family which is a 2+2 family. And we then start this whole movement. Are you on board for it?
We're fully on board. It's a great idea.
Yeah.
We have something on a small scale with the BSBF program,
No,
but
I
this
saw her
sounds
clapping
much
her hands.
larger.
So
Yeah,
tell
this
us
sounds
about it.
much larger. We're definitely on board.
So what are you doing in this small program?
Actually, what we do is we go to BSBF, we do exactly what you're saying, which is we disseminate the information, how to brush, how often to brush, how to use your toothbrush, how often to replace it, nutritious food and no tobacco, like the Honorable Minister said. And then we give them a calendar to say, go home, put up that calendar somewhere on your wall, and every day that you manage the 2+2, give yourself a tick. And then bring that back at the end of the month and share it with your teacher, and then the teacher then shares it back with us.
So I was just thinking, if it's an app, it's an interactive thing where they upload a picture every day of their brushing, morning, evening, it's clocked, however we do it. And then at the end of the month, the children who eventually are regular with it, then get to be part of the entire Colgate ecosystem of smiles, bright smiles, bright future
Great
ecosystem, somewhere they are showcased, and it becomes a big idea. It's possible.
It's a great idea. Whenever there's work, I look at Shilpa, so I'm looking at her this time as well. So, but it's a great idea.
So policy interventions possible, habit formations possible, greater interventions possible. Anything else? Final words? We got 10 seconds on the clock.
The main issue is also is in the rural areas and far-flung areas, tribal areas. Unless we reach there, our issue will not be taken care of. So, you talked about curriculum reforms or some changes. Lot has been done. Every dental school today have a tobacco cessation center. It is a mobile clinic. It has a rural posting. But I think still more needs to be done. I feel that so far our training as a dental graduate is predominantly clinical oriented. I think somewhere we need a push for promotive and preventive training. Our training is competency based, but it is clinical oriented. How do we treat a patient? And then I think a lot of incentives can be given to the graduates. You go to the rural service, gateway to MDS. Everybody is aspiring to get a postgraduate seat. So if you do there, we have special seats for you. If you serve there, there are special jobs for only rural areas. People are looking for jobs. So all these loans, so many, recognizing them, giving them fellowships, making them scholars. There are so many things which can be done.
Possibilities are immense. I think somewhere you'll have to get a little bold, little creative, little innovative, and also get out there into society saying that we're out here to ensure that we are a healthy, oral healthy nation by 2047, Prabha. So all the best to you and to everyone. One radical thought I thought, every time a cigarette packet is bought or a gutka packet is bought, there should be a small Colgate mouthwash or a toothpaste saying we can't do anything about the stains on your lungs, but we can surely help you with the stains on your teeth. Anyway, on that note, thank you so much. Thank you. Thank you.
And now, ladies and gentlemen, we move on to the most awaited part of this evening, recognizing our champions of smile. These remarkable individuals and organizations have gone above and beyond to advance oral health in India through innovation, outreach, education, and advocacy. Each of them represent the spirit of this movement, dedicated to ensuring healthier smiles and brighter futures across the country. Please join me in welcoming and celebrating our champions of smile. May I also have on stage Ms. Prabha Narasimhan once again to honor these champions. Indu Bhushanji, can I please have you on the stage as well? Okay, let's get started. I would like to first up invite Dr. Ashok Dhoble, Honorary Secretary General, Indian Dental Association. He's displayed visionary leadership at the ID and has tirelessly advocated for technology, education and policy reforms that have elevated oral health standards across India. Heartiest congratulations, sir. Thank you for your valuable contribution. Amongst us is also Mr. Bhomik Shah, founder and CEO, CSR Box and Bharat Cares. He has spearheaded impactful partnerships through CSR Box and Bharat Cares, bringing oral health education to over 1.3 million students and 25,000 schools through the Colgate Bright Smiles, Bright Futures program. A huge round of applause, please. Thank you for being here, sir, and heartiest congratulations once again. Next, I would like to invite Professor H.U. Malik for his outstanding contribution in advancing dentistry and education in Jammu and Kashmir, mentoring generations of dental professionals and championing community-driven oral health programs. Heartiest congratulations, Professor Malik. And now, may I invite Priyanjit Ghosh from Logi AI, the technology partner of Colgate Oral Health Movement. Logi AI has been developing digital health tools that have enabled dental screenings for over 3.2 million Indians, transforming access to early oral disease detection across the country. Congratulations to Team Logi AI. Thank you for the incredible initiative. And next, I would like to call on stage Dr. Saurabh R. Birla for pioneering oral hygiene awareness campaigns, free dental camps, and record-setting community initiatives that have reached thousands of children and underprivileged communities. Congratulations, Dr. Birla. And with that, I would like to invite Dr. Pravesh Mehra for his contributions. As a leading maxillofacial surgeon, advisor and educator, Dr. Mehra has been shaping national oral health programs and innovative telemedicine initiatives. Heartiest congratulations, sir. Also present amongst us is Dr. Deebu J. Matthew, known for his exceptional work in disaster relief, mass awareness campaigns, and inclusive dental care, also ensuring quality treatment reaches the most vulnerable communities. Can we please have a huge round of applause, ladies and gentlemen? Heartiest congratulations, sir. Next up, I would like to call on stage Dr. Sarah R. Christopher for her leadership in women's oral health and community outreach, delivering over 500 impactful programs focused on empowerment, prevention, and education. More power to you, Dr. Christopher, and thank you so much for being here today. Heartiest congratulations once again. Let's now move on to the next great initiative, and for that, may I have Dr. Yogesh T. Chandrana on stage, please, known for his pioneering work in dental awareness through India's first private dental museum and interactive education platforms, inspiring future generations in oral health. Dr. Yogesh's contributions in the field have been truly remarkable. Heartiest congratulations, sir, and thank you for the incredible work. Let's now move on to another change maker who has championed preventive dental care through large-scale free camps, educational outreach, and grassroots initiatives that prioritize public health in underprivileged communities. Dr. D.V. Vidyasagar, can we please have you on stage for the honors? Many congratulations, and thank you for being here with us today. Now I would like to call on stage Dr. Sachin Dev Mehta for advancing oral health awareness, professional training and community engagement across Punjab and beyond, representing India on global dental platforms. Heartiest congratulations, and thank you so much for all the great work you do. And lastly, we would like to congratulate Dr. Pratibha Atwale for her dedicated contributions to advancing oral health in India with a focus on clinical excellence, education, and community service. Since Dr. Atwale could not be with us this evening, we're pleased to invite Dr. Jyoti to kindly come forward and accept the award on her behalf. Thank you so much. Thank you, everyone. Let's have another round of applause for all the incredible champions of Smile. Some great work we've seen today and we've spoken about. And now, ladies and gentlemen, we shift our focus to a conversation at the heart of every household. Because after all, it's within our families that lifelong health habits take root, isn't it? So it gives me great pleasure to invite Ms. Mandira Bedi, needs no introduction, renowned actor, fitness icon, entrepreneur, and an inspiring mother. She'll be moderating our next session. Mandira's not only made a mark in the entertainment industry, but is also a strong advocate for wellness and healthy living. We're delighted to have her lead this important discussion on nurturing smiles, the importance of oral health for families. With that, I would also like to welcome our distinguished speakers to the stage. Dr. Ashok Dhoble, Honorary Secretary General Head at Indian Dental Association. Okay. As we wait for Dr. Dhoble, I would like to call upon Dr. Sunita Swaraj, Principal of the Heritage School Vasant Kunj. And Ms. Kishwar Merchant, actor, mother and influencer, completes the panel this evening. A huge round of applause, ladies and gentlemen, for what is going to be a promising and very relatable conversation.
Good evening, everybody. I was listening to the last panel discussion very closely, and what I got from what Ms. Narasimhan said was that when women will be in charge, everybody will be brushing their teeth. Twice a day for 2 minutes at 2 rupees a day.
I am so in charge right now.
No, but you know, the indifference, that is something that was discussed, the indifference towards oral health. Very recently, every birthday month, I go for an entire medical checkup, and I get everything done. And when it came down to the dental checkup is also a part of the package. And they said to me, you know, you don't have to do it if you don't want to. So that's the level of indifference there is as far as oral healthcare is concerned, and that's very sad. I said, no, I would like to get my teeth checked, and I want to see how I'm doing, and I want to get a good score, a good scorecard. But Dr. Dhoble, let's begin with you. We're going to get into the whole family aspect of oral healthcare. What generational patterns have you seen within families as far as poor oral healthcare is concerned, and what steps can families take to, combat this?
First of all, in the family, these habits to be inculcated, because the family is the first place where the oral health starts. And if the families, particularly the parents, if they are not aware about the importance of the oral health, they cannot pass on to the child. So this is the first step. We are observing for the period of last 25 years. Importance of the oral health is not there in the family itself. And when the particularly parents, they are taking care of their oral health properly, they can inculcate same pass on to the child. So this is a good part. Now, earlier, we used to carry only importance of the oral health to the children to be given, and the school used to be there. But now we are stressing it should start initiating the family itself.
No, but what are the patterns that you're seeing of poor oral health care?
Yeah, poor oral health care, because since there is no awareness about the importance of the oral health, so that part is not happening. So it should, from generation to generation, or we can say that now we should insist more about how the family can get involved into the oral health awareness, and how can the children also can be the part of that.
Dr. Swaraj, as an educator, you believe in value-driven learning. How can families and schools together embed oral health as a part of the value system of children?
Thank you, Mandira, for the question. I just have a question for all of you sitting here. How many of you were taught in school, brush every day? Can I have show of hands? Twice. Yeah? But we are at such a situation right now. When it comes to oral health, brushing, we tend to get lazy. But how can we really work on it? As Dr. Saab was saying, that ये बच्चों से शुरू होगा. So ये बच्चों से कैसे शुरू होगा? हम सबको शुरू कराया था हमारे schools ने. But I think there is a great need of reinforcement. There's a great need of integration in the curriculum, which with national education policy, with project-based learning, experiential learning, this is something that we're bringing it into the modules. So it doesn't just happen once in a lifetime or a school time, but it has to be completely a reinforcement revisit. So when there'll be a revisit, there would be a value system which would be created. Because when a child goes through this learning or revisits or brings it into the conversations inside the classroom or in the learning spaces, they're going to carry it home. They're going to talk to their friends in the park. So there'll be a lot of conversations around it. And when conversations happen, I mean, I was sitting here and I'm scared right now because the conversations that were happening were around cancer. How many of our children know about it? So there's it doesn't stop over there that we just say brush your teeth twice. But the entire process has to be mapped when a child begins the learning, and it has to really be, if the child is aware, he's going to carry the awareness home. And aware matlab superficially aware nahi, ya ratta marna wala aware nahi. It has to go deeper. The deeper learning is extremely important.
How do you keep the conversation going through the year without them, you know, switching off, zoning out?
So, I think I've always marrowed very ratta maar ke main itni badi ho gayi. But today's generation, I don't think they believe in ratta marrowing. They're more of they want to understand, they will have tons of questions. If you don't answer them, they'll keep questioning you. That's the kind of generation that I'm seeing today. And I'm glad that these generations want to understand, want to go deeper, and want to keep questioning. They're amazingly curious. All we need to do is, we need to be prepared to handle this generation. And yeah, we'll do it.
Kishwar, you and I are in the same boat. Every night I tell my kids they need to brush their teeth, and they say why, and not now, and later, and then they fall asleep. And then, then there's that question of, should I wake them up? Because they've fallen asleep and they've just eaten something. Yeah. I mean, how have you made oral health, brushing teeth, oral hygiene fun and also non-negotiable?
Well, you know, like they say that kids imitate what they see. And if they see you brushing with intention and joy, I think they just follow, right? So what I do, from the time Nirvair actually started brushing his teeth, Suyesh and I have made it a point that we enter the bathroom with him and we brush our teeth with him. So, you know, he sees us, and then like we compete, कि कौन first आएगा brushing में. So, you know, like वो एक incentive है for him also, that, you know, he's going to come first. So he's fighting with us for that. And we kind of make it fun for him, you know, like they were saying, schools have these charts. So I have that chart on my fridge. It's like a magnet chart that I have on my fridge where he goes and, you know, sticks every time he brushes. And at the end of the week, you know, if it's complete, he gets like a little treat, or maybe just watch something with him, you know. So we kind of do all these things because there are times when even I am lazy. So I can totally understand that, you know, he's just not even 4. So for him to be lazy and to not want to brush his teeth is absolutely...
Would you say it's become a habit? Would you say he'll do it if you do not actually push him to or take him with you?
I think so, because you know what? I bought him these brushes which have Spider-Man and Batman, okay, on it, like his favorite characters. So he kinds of alternates between, you know, the two brushes every day. And there are times when he'll just wake up in the morning, he'll open his eyes and the first thing he'll say, brush kare?
Really?
Yeah. And I'm like, haan, chalo,
hats off to you, Mom.
Yeah.
Very well done.
So that is why I was like, it's me, you know, So I am in charge of this because, frankly, I was never a child who liked to brush. But now I think I know the value of it and I want to, you know, like get him to do it. So.
Dr. Dhoble, like I said at the beginning, you know, in that health checkup, they said you can do the dental checkup if you want to, but you don't have to, kind of thing. Why is it that people only go when there's problems? Why is it that people only go when there's things that need to be addressed and things that need to be fixed? And how do we change the mindset of people for them to get to the dentist for a regular checkup as a part of their, health and wellness routine?
Usually in our society, unless there is a problem, people don't go to either any doctor or dentist. But in the family, if the habits are inculcated, when the child is born, the first tooth erupts, the first visit to the dentist should be there. And then every 6 months it should be followed. But importance of the oral health, if the parents, they know, then they can definitely pass on to the child. And usually children's parents are the first teacher, they usually imitate parents. Then goes again in the school also, then in the friend circle. So importance of the oral health, like just any other habits, it should be this habit about brushing, then visiting dentist. And
how do you get people to visit dentists on a regular basis to say, let's go now, like we go for a health checkup, we go for a dental checkup?
Yeah. First for the dental checkup, typically they have been, in the parents in the family we have seen, if they tell about the pain in the tooth, then they scold them, means they tell the child, if you do something, I will take you to the dentist. That should not be there. And they should encourage the child visiting dentist for telling that your dentist is your friend, he takes care of your teeth, he takes care of your smile. This is how the child should be encouraged to visiting dentist.
How can we do that possibly in a school level? Make people feel, positive about healthcare and move away. I mean, you can't do this through textbooks. You can't do this this got to be done practically. So how do we do that in your opinion?
I've been working in this school for past 12 years and we completely believe in modules, project-based learning. Textbooks है नहीं हमारे स्कूल में क्योंकि बच्चों को टेक्स्ट बुक कतई पसंद नहीं, मुझे भी नहीं पसंद थी. Now the children, if they do not get hands-on, if they don't understand, as I was saying earlier, अगर उनको ये समझ में आएगा ना कि 6 महीने बाद डेंटिस्ट के पास जाएंगे तो फिर दर्द नहीं होगा, और they understand why is it that it is important to go to the dentist. So it's all about we parents or we seniors, we've always been into that डंडा वाला मोड कि डंडा लेके वो पुलिस की आदत सबको है ना, पुलिस खड़ा होगा तो गाड़ी ट्रैफिक लाइट तोड़ेंगे नहीं, right? So we've been always on our children that okay fine, this is the chapter, finish हुआ, 5 question के answers लिख दो. That's not learning. They're just not understanding anything. So if you have a module which will have a revisit every 3 months, every month, that is coming. So दांत अलग से दांत नहीं हो सकते. It has to be, it comes in your eating, it comes in your overall health. तो दांत तो रोज ही काम कर रहे हैं ना, तो आप ऐसा कैसे हो सकता है कि you can just finish it in one chapter? We are not yet prepared because we are finishing a chapter still in most of the schools in our country. We need to really get down to collaborative model wherein discussions happen. The classroom, कतार में ही बैठे रहते हैं. मैं तो कतार में बैठती थी, बैक बेंचर, सोती ज़्यादा थी, तो कुछ समझ में नहीं आता था. But today, I think we all need this kind of a seating in the classroom wherein they are interacting with each other and they're learning from each other, they're having conversations with each other. That is something that can really bring in a lot of change.
How about something with parents and teachers and children?
Yeah.
Something like that.
I mean,
get the parents involved in
But I want to add something to this. Nirvair was just 3 last year, and he's in a Montessori, and they actually took him to a dentist for a dentist visit. So, you know,
as a field trip?
Yeah, as a field trip. They took him there, and, you know, they, matlab, obviously, wahan pe sab dikhaya, matlab, bataya and everything. I don't know how much he understood, but they did that. So they've actually started doing that, which is a very good thing, you know. That at the age of 3, you actually visit a dentist and you don't know who the person is, what they do, but
so we do have a dental checkup every year in the school. कुछ ज़्यादा बदलाव आता नहीं है एक visit से या एक dental checkup से. I think deeper understanding is extremely important for any change to happen anywhere.
How many visits to a dentist are, you know, prescribed in your opinion, if nothing is wrong? How many times a year should one visit a dentist?
Twice a year should be.
Every 6 months.
Every 6 months to be visited. And, you know, the importance of the visit is very important. The parent should tell the child that why you should visit the dentist. And they should introduce as a friend. Now we are introducing this program from Indian Dental Association to the KGs, and where what's he advise about visiting or taking all the children to the dental clinic as a part of that, their visit. And the dentist explains everything about the chair, how the teeth are examined, even the probe and mirror or instruments are given to the child. Then they start brushing there, painting, all such small activities. If they are carried out in the clinic or in the school, they get involved into it.
And fear should be taken out for sure.
Yes.
That, you know what, if you don't take care of your teeth, the dentist is going to take, you know, your teeth out and you're going to get an injection. And these are the kind of things that parents say to their kids, which is very counterproductive. But Kishwar, how do you think that influencers and public figures like yourself can make oral health awareness, you know, more engaging and aspirational?
I think, you know, influencers can really influence right now.
I don't think your mic is working.
Is it not? Thank you. So, I feel that influencers can really, really influence if they want to. And I think this can be done by just telling their stories, by just being very real, you know, about, suppose, you know, like probably Nirvair, if how he resisted earlier, you know, to brush his teeth, and how we made it work can be probably shown in a reel, you know, to people. And maybe people might just, you know, grasp that and probably start doing that at home, like what we do now. So things like that, maybe like a, you know, like they can do like a bedtime reel, just may, you know, it can be like a self-care for mother and child. So, you know, of brushing and brushing twice a day. So, I mean, you know, we can actually do a lot of things. And now that I've said that, I think I should also start just doing something like this.
Have you done something like that?
No, I haven't. But now when I go back, I should do these kind of reels. I think they'll really work.
How do
Colgate, are we in or what?
How do we make oral health care cool? How do we make brushing cool? How do we do that in schools? Give us an idea.
हाँ, आजकल की जनरेशन super cool रहना पसंद करती है. So I am basically called a cool principal of a cool school.
Okay.
We don't have uniform. I'm not promoting my school. Okay. So अभी के बच्चों से there's some children here. उनको जब आप chilled रहोगे ना, you're cool, they'll understand you better. So my children, my school children, my biological children also, my children come to me and school में कोई problem है ना किधर, तो वो principal के पास आते हैं instead of going to the teacher. And I don't remember going, even seeing my principal once in a year. So I really want to, and through the project-based learning and through experiences, I think children understand better. You need to be cool in school. Even parents at home, you need to really be cool with today's generation. This is not a generation जो आपका बिल्कुल भी आदेश सुनेंगे.
They won't listen without questioning. They won't
yes.
listen without explanation. They won't listen without...
आदेश नहीं सुनने वाले, डंडा नहीं देखने वाले. They are going to just, if they understand, if you really reason out with them, they're going to be, you would be super cool and they will be super cool.
Yeah, you either reason out with them or you just make it fun.
Yeah.
Not working. Can we have a mic for Kishwar? It's still not working. Okay, I'm going to ask you another question till we get your mic working, Dr. Swaraj. In your view, how can we equip parents to overcome these modern, lifestyle challenges like screen distractions and sugary diets and become really good role models for, children?
बहुत मुश्किल प्रश्न है. पेरेंट्स को बदलना बड़ा मुश्किल है, बच्चों को बदल सकती हूँ मैं. So I would really want to mention this कि पेरेंट्स को जब बुलाती हूँ, I've stopped putting this word as mandatory. I've started using it is important. आपके लिए जरूरी है, तो पेरेंट्स को बुलाती हूँ, नहीं आते. मतलब मैं अगर बात करूँ 6 साल पहले, मेरे ख्याल से 6 साल में जो काम मुझे करना था बच्चों के साथ, अब बच्चे खुद पेरेंट्स को लेके आते हैं. So we'll have to really, in a private school या गवर्नमेंट स्कूल की बात मैं करूं, तो पेरेंट और टीचर आमने सामने होते हैं. I've stopped PTMs in my school. SLC होते हैं, स्टूडेंट लेड कॉन्फ्रेंस. वो बच्चा बोलेगा मैंने क्या कर लिया और क्या मुझे आगे करना है. पेरेंट को हम मौका कम देते हैं बोलने का. Even teachers don't talk. The child talks. So when child talks, हर एक पेरेंट को अपने बच्चा जब बोलता है ना, तो बड़ा खुशी होती है. वो अंदर से एक आता है कि मेरा बच्चे को इतना पता है. So we rooting it through the children because it's near to impossible to bring all the parents into the classroom, but we're doing it with a discovery day. Every day there are 25 parents in the school throughout the day. So that is making a lot of sense to us, but inviting them for a gyan session, nahi aate parents, or seriously it doesn't make sense.
Well, speaking of role models who are parents, we have Kishwar here who's a role model. So talk to us about sugary diets and digital distractions and mindful eating.
Don't kill me, okay? No. So I don't want to be a parent who doesn't want to give the child anything. Obviously, hum bhi to bahut khate the, right? When we were small, we used to eat a lot of candies and chocolates. So, but I make a conscious effort of balancing it out, with good food, with this, and I generally try and give it to him only when we are on a holiday, which is hardly so like that. And I have told him very clearly that every time he eats chocolate, he has to rinse or he has to brush, So I think wo sugar residue thoda less ho jata hai. So I try and do that with him. And he knows that he has to brush twice, every day. He has to tuck his teeth to bed before we tuck him to bed is the rule of the house. So, I kind of, from my level, try and do whatever I can. But he does eat chocolates and he does eat candy.
Since you're of that age, your son is of that age, doesn't the tooth fairy come into the picture anywhere? Because when my kids were small and they lost their teeth, they got nothing unless a letter was written to the tooth fairy promising brushing twice a day and taking care of our teeth.
No, so he already does that. No, he does.
The tooth fairy is a very important character in the early
I know,
years.
but ab tak wo aaya nahi hai because his teeth are still...
Okay,
yeah. So...
If we could leave this audience with one creative way to make, oral health a priority. One from each one of our panelists before I ask some questions of the panelists. One creative way to make oral health a priority. Dr.
Oral health can be made priority from the school, from the family, and it should become, compulsory for every school, particularly. They should have one specific day or half a day that is dedicated for the school oral health and importance of oral health, and the children should be involved in some activities. Where if they are involved in the activities, then they start inculcating that habit. The teachers are the role model, and I second definitely the influencer can play. I can tell you, influencer, they become the community dentist.
Yes, totally.
Yeah. And they follow that. And definitely this oral health will become the priority.
No sweets in the canteen.
Oh,
it has to be completely up to millet driven canteen hai meri. So we're trying to just withdraw sweets from the canteen. Yeah.
I think make it fun, like make the brushing and the whole process, of oral hygiene fun for them. Like, maybe storytelling while brushing or anything, like just, music or something for those 2 minutes that, he brushes aram se. And
Sadly, I'm going to share my experience, and mine is still negotiation. So I say, go brush your teeth, or else we can't do this fun thing afterwards. I mean, at this point of time, this is what works until at one point it'll be the pennies dropped and they just know they have to do it.
See, right now
and they
he's
don't have
just
to be
poor.
forced to do it.
So he listens, right? But
Right.
maybe later I might be sitting here saying the same thing.
Welcome to the world of negotiation. Okay, some questions for the audience I have. Okay, so how many parents are here in the audience? Parents. Okay. Who all find it tougher to get their kids to brush at night? Hands up. Night. Brush in the morning? Everybody brushes in the morning. Really? Your son or daughter doesn't like to brush in the morning? You don't like to brush in the morning? I can't hear you. Can we have a mic? Get it? Oh, you didn't hear the question. The question is, which parents over here find it hard to get their kids to brush in the morning or at night? Mostly at night. To get kids to brush and then go to sleep. That's the tough one. I think everybody likes to brush their teeth in the morning.
They just try and like fall asleep and all of that.
Yeah.
वो सब बहाने भी तो होते हैं
Yes,
उनके
the
बहुत नींद
excuses.
आ रही है.
Yes.
Yeah.
Okay. Parents, where are the parents? Hands up, parents. When you are buying snacks for your kids, do you look at the label for sugar? Yes? Okay. one parent puts his hand up, who's a very informed parent who just conducted the last panel discussion as well. Can we have a mic here, please? Or should I come to
it's
you?
working.
Yeah, mic is coming.
So it was our kids who realized this, because I got Revant Himant Singha, the food farmer, to do a session with the kids at the school. So the moment they saw Revant talk about sugar levels, what to read and how much to have, that day onwards, they've said, Dad, this has got more sugar, this has got less. So even with granola or with muesli, this one's got more sugar, so I don't want this. This even has saturated fat, so can we get something which that doesn't have? So that's the level of evolved thing, and I'd been trying to get them to understand this for 6 months. It didn't happen. And one guy stands there and says this to a whole bunch of kids in school, and bang on, it's gone.
But here's the thing,
into their heads.
do they stick with it? Because
Yeah,
my
they
daughter came home one day and said, I'm not eating this because this is junk food. I've learned what junk food is. And that lasted all of 1 week. And the next time that was on the table.
The weekend is the cheat days. Weekend are the cheat days. Weekdays are not cheat days. And both of them are into sports. One is into football, one is into swimming. So if they want to keep up there, so they need to be conscious. So it just comes like that. An active lifestyle brings that consciousness.
Okay. Thank you. The next question is, how long should we be brushing our teeth? Please put your hands up. No dentists are allowed to answer. No, not you. You know everything. Yes? 3 minutes. Really? Doesn't that do too much to the enamel? 3 minutes is a lot.
2-2-2 rule, remember?
The 2-2-2 rule, exactly. Is it 2 minutes? 2 minutes morning, evening, or 2 minutes combined? 2 minutes morning, 2 minutes evening.
night.
Okay, I'm guilty of brushing my teeth for 1 minute only. I'm always in a hurry, but 3 minutes? Definitely not. Not? Okay. Now, hands up, and you're allowed to tell us the truth because everybody's done it at some point or the other. Who's ever rushed out of the door for school or work and forgotten to brush their teeth? Okay. Kudos to you for your honesty. Yes, the gentleman at the back. Anyone here? Yes? Yes. It's happened to all of us. I know that everybody isn't putting their hand up right now. At some point or the other in your life, you've forgotten to brush your teeth. That's happened. Happened to you as well, right? Really?
So
Not in your entire life?
No. I really want to share this. Once I forgot and I've started keeping a brush and a toothpaste in my bag.
That's a good one. That is a who keeps a brush and a toothpaste in their handbag? I tend to brush 3 times a day sometimes. Yes? One person sitting here. Okay. You were saying?
I was saying that even if I'm traveling, I do for sure keep a brush in my bag. For sure.
I'm guilty of it happening once or twice in my life. I can say it. Not very proudly, but it's happened. Okay. Can someone over here who's not a dentist tell me 1 food or 3 foods? 3 foods that are actually good for your teeth, great for your teeth. No one. Apple. An apple a day keeps the dentist away, but don't keep the dentist away. Visit the dentist once a year or twice a year. Yes, twice a year. Any other foods? Oranges. Oranges are good. Citrus fruits are good. Yes? Okay. Milk, calcium. Yes. Cheese. Sure. Yogurt. Veggies. No? Yes. Crunchy vegetables.
Raw veggies.
Balanced diet.
Balanced diet. Good for the teeth.
Thank
Always.
you.
I think raw veggies.
Raw veggies. Yes. Carrots.
My dad was in Air Force और हमारा एक आंगन हुआ करता था. वहीं से मूली उखाड़ी, गाजर उखाड़ी और खा लिया तो दांत बिल्कुल बढ़िया रहते थे.
Nice. All right. Now, for the dentists who've not been allowed to answer any of the questions, who are the dentists here? Hands up. Okay, the whole room. The whole room, okay.
Whoa.
Maybe we can ask this question of 3 or 4 people, 3 or 4 of the dentists here. From your experience, what is that one dental myth you always find yourself clearing for patients? Okay, the gentleman at the back, can we have a mic reach the gentleman at the back, please?
Am I audible?
Yes.
First of all, thank you for allowing me to answer this. And I can proudly say I'm a huge fan of yours, even Kishwar. So
Thank
please,
you,
yes.
thank you.
मतलब मैं बहुत देर से इंतजार कर रहा था, आप बैठे थे वहाँ पे, मुझे लगा था मैं सेल्फी ले लूँ, फिर पता नहीं सिक्योरिटी इश्यूज ना हो जाए. तो the answer is स्केलिंग से दांत वीक होते हैं. ये एक बहुत कॉमन मिथ है, बट स्केलिंग कराना, ओरल प्रोफिलैक्सिस is the best way to keep most of the disease away. The gums disease is very pertinent, and during the cleanup itself, we can have a look at a 360-degree view of the patient's mouth. We actually know कि situation क्या है, क्या grade है उसके health का, and वो सबसे बड़ा myth है इस वक्त.
Thank you for sharing that. There's so much
Dr. Weber.
that teeth actually reveal. My daughter is adopted, and we didn't know her exact age, so we took her to a dentist, and we did an X-ray of her teeth, and we got to know her exact, close to exact age because of that. And of course, there's so much to be said about heart health and the state of one's teeth and gums, isn't it, doctor? Heart health, cardiovascular health, yes. And heart
oral health is linked to the
that's right,
cardiac
yes.
diseases through the periodontal infections. So many times they are not aware about the importance of the oral health to the general health.
Yes, yes. Okay, any more? Any more? Yes. Yeah, a mic will come to you.
Thank you for this opportunity, Mandira. दूध के दांत झड़ने वाले हैं, why take care? I'm a pediatric dentist, so I get to see that all. कैसे भी जाने वाले, why do you have to take care? That's a question.
Sorry, क्या जाने वाले?
दूध के दांत.
दूध के दांत.
झड़ने वाले.
Oh, why do you need to take? Oh,
So they don't understand that it's a natural space maintainer.
Right.
They have a life. Each tooth has a life there. From the first teeth to the last tooth, quite a long life they have. So they have a role to play for your phonetics, nutrition, and also. So it's a big answer as a pediatric dentist for me to do, but I do that.
Wow.
I really want to share this. I really want to share this. Out of 10 preschool children, 8 have dental issues, as per the research. So that's a concern. And Colgate is really doing a magical job by reaching out to so many people. So I think we need to really applaud. थोड़ा जोर से भाई, इससे ये applaud करने से भी दांत ठीक होते हैं.
We all live in a country, the truth is we all live in a country, when we ask for toothpaste, we don't say toothpaste, we say Colgate milega ke nahi. So I've grown up brushing my teeth with Colgate toothpaste, and that many years gone by, I still use Colgate toothpaste. Even though there are so many other wonderful options from Colgate, I use Colgate toothpaste and I love it. I think my time's up, but I have time. One question.
May I have last one, please? May I have last one? May I have this side, please?
Yes.
हम बात कर रहे हैं मिथ्स की. दंत चिकित्सा में 2 बहुत बड़े भ्रम हैं. एक तो मीठा खाने से दांत खराब होते हैं. यदि मीठा खाने से दांत खराब होते तो आज से 80 साल पहले, 70 साल पहले डेंटिस्ट ही नहीं थे. क्या लोगों के मुंह में दांत नहीं थे? Am I right, wrong? मैं ठीक कह रहा हूं, गलत कह रहा हूं? जोरदार तालियां तो बनती है ना मेरे लिए क्वेश्चन उठाने के लिए, पर आंसर भी दूंगा. 70-80 साल पहले डेंटिस्ट ही नहीं होते थे. डेंटिस्ट्री, अच्छा, दांत के भी डॉक्टर होते हैं, दांत के भी एक्सरे होते हैं, हमने वो भी समय देखा है. बट वाज द रीजन? और दूसरा, अभी मेरे माय कलीग ही सेड कि स्केलिंग से दांत कमजोर होते हैं. यस एंड नो, बोथ. माय लेजेंडरी mentors are sitting, respected Dr. Mahesh Verma and Ashok Dhoble ji. Yes, ये ठीक भी है, गलत भी है. मैं पहली बात पे आता हूं. क्या मीठा खाने से दांत कमजोर होते हैं? मैं कहता हूं नहीं होते हैं. क्यों नहीं होते हैं? 70 से 80 साल पहले मैं ही कह रहा हूं कि डेंटिस्ट नहीं होते थे. लोगों के मुंह में दांत होते थे और मीठा तोल के खाते थे. बाय वेट दे यूज्ड टू, दिस इज अ प्लेजर ऑफ द लाइफ. गुड़ इतना खा लेते थे कि जितना आज हम खा लें तो हॉस्पिटल में एडमिट हो जाएंगे. व्हाट वाज द रीजन बिहाइंड दैट? व्हाट वाज द साइंस बिहाइंड दैट? यू कैन नोटिस, आप आज भी नोटिस करेंगे, आपके घर में कोई बुजुर्ग है या कोई पुराने समय का व्यक्ति है, जब वो खाना खाता है तो 1 गिलास या 1 लोटा पानी लेके रिंज करता है. ओरल रिंजिंग इज द बेसिक साइंस. जोरदार तालियां हो जाएं यदि सहमत हैं तो.
जोरदार तालियां. थैंक यू सर, थैंक यू वेरी मच.
दूसरा, लेट मी कंप्लीट द टेक्निकल थिंग. दूसरा, दांत स्केलिंग कराने से दांत कमजोर होते हैं. मैं कह रहा हूं हाँ, होते भी हैं, नहीं भी होते हैं. इट डिपेंड्स कि किस समय आप स्केलिंग करा रहे हैं. ये लेटर ऑन स्टेज पे स्केलिंग कराएंगे, लेटर ऑन स्टेज पे स्केलिंग कराएंगे तो वो दांत कमजोर होंगे. यदि शुरू में आप स्केलिंग सफाई करा लेंगे इन इनिशियल स्टेजेस, देन इट विल नॉट हैपन. थैंक यू वेरी मच.
Thank you, sir. I'm sure you enjoy sweet. You enjoy sweet? Good. All right. Thank you very much. And thank you very much to the panelists for that lovely discussion. Lots of creative ways to keep people brushing their teeth and taking care of their oral hygiene. Thank you very much to the panelists. Big round of applause for them. Thank you.
Thank you so much, Mandira, for that wonderful session. Thank you, speakers, for bringing such warmth and enthusiasm to the conversation. And thank you, audience, for being such a sport and for the manner in which you participated with all honest answers, I must say. And now, as we continue this inspiring journey together, let's move on to the next part of the evening. Oral health, ladies and gentlemen, plays such a vital role in our overall well-being. Yet we know how much more needs to be done to build awareness and inspire action. As part of this movement, we are delighted to present a very special performance. 5 wonderful young children are here with us today. They're champions, to say the least, to launch the BSBF anthem, a song that celebrates bright smiles and reminds us of 5 missions of Colgate Bright Smiles, Bright Future program that can make all the difference. We've spoken about it through the last few hours: brushing the right way, brushing twice a day, changing your brush every 3 months, eating nutritious foods, and saying no to tobacco. This inspiring anthem has been beautifully written by Swanand Kirkire and set to music by Miku Patel. Please join me in welcoming our young performers to the stage. A huge round of applause, ladies and gentlemen. Ye to banta hai.
हम बत्तीस हम तो सब
What a wonderful and uplifting performance, isn't it? And must I say, a perfect way to close today's meaningful gathering. Thank you so much once again. This anthem will go a long way in inspiring children, schools and communities to embrace good oral hygiene habits from an early age, helping build a healthier future generation. And with that, I would like to extend my deepest gratitude to all our esteemed speakers, experts and participants who have made today's summit truly insightful and impactful. We're especially thankful to Shri J.P. Nadda ji for gracing the event earlier and sharing his valuable thoughts, setting the tone for the important discussions we've had the past few hours. His presence was truly inspiring. And a big thank you to our partners, supporters, and the entire organizing team whose hard work made this summit possible. Let's carry forward the ideas and commitments shared today to build a healthier, stronger future together. Do join us for dinners, ladies and gentlemen, and also networking in the Mumtaz Hall. Thank you once again and have a wonderful evening. Let's keep transforming smiles together. Good evening and good night.